MMT Lumbar Spine Extension. See text for complete list of muscles. Assist the patient to the prone position with the trunk supported on the table. Stand at the side of the legs to stabilize the lower extremities at the ankles. If the patient has weak hip extensors, you can stabilize across the upper thighs. Due to the difficulty of passively moving the trunk through extension, you do not assess the available range of motion in the trunk. In patient-appropriate language, ask the patient to clasp the hands behind the head and extend the lumbar spine until the thorax is raised from the table. The xiphoid process should clear the table. Common substitutions include any trunk motions that are out of the plane of lumbar extension. Please note that it is not necessary to have the patient perform the active motion twice if no substitutions are observed on the first attempt. You may continue with the test at this point. After correcting any substitutions, ask the patient to perform the motion as previously while stabilizing either at the ankles or across the upper thighs, whichever is appropriate. The resistance in this test comes from the weight of the patient's trunk. Observe the patient's response to the test. This is how you will assign a grade. Grade 5, normal. The patient completes full range of motion in lumbar spine extension and the muscles lock the trunk into position with no wavering. Grade 4, good. The patient completes full range of motion in lumbar spine extension, but yields slightly because of an elastic quality at the end point. For grade 3, the test is a combination of lumbar and thoracic extension. The patient must be repositioned. The patient remains prone on the table but slides up so that the upper chest is off the table. The arms are at the side. Stand at the side of the table and stabilize the legs at the ankles or at the upper thighs, which is determined by the strength of the hip extensors. Instruct the patient to extend the spine, raising the body from the table. The patient must be able to clear the xiphoid process from the table with the arms maintained at the side. Grade 3, fair. The patient completes full range of motion in combined thoracic and lumbar extension. For grades 2, 1, and 0, reposition the patient so the entire body is supported on the table. Ask the patient to extend the spine and raise the body off the table while maintaining the arms at the side. Grade 2, poor. The patient completes partial range of motion, does not clear the xiphoid process. For grade 1, you must now palpate the thoracic and lumbar spine extensor muscles by placing your fingers over the muscle masses adjacent to both sides of the spine. The individual muscles cannot be isolated. Grade 1, trace. Palpable contractile activity with no movement. Grade 0, no palpable contraction.